Okay, so welcome to the Issaquah Senior Center Learning Lab series. We're so glad that you joined us. For the month of May, our goal is to empower you seniors with information about COVID-19 that will help you navigate these challenging times with more ease and confidence. So this is how it works. This is how we're going to do it. We have a speaker, which is Nicole. She has a topic, safe and practical tips for managing healthcare needs during COVID-19. We'll have a Q&A, and then if we have time, we'll have an open discussion. So I just want to introduce you to Nicole. She's a licensed clinical social worker and certified care manager. She is currently the director of care management at Aging Wisdom, a care management practice providing consultation and guidance to older adults and those living with dementia. So take it away, Nicole.
Thank you, Catherine. Thank you for allowing me the opportunity to get in front of all of you. And I have to say kudos to you for quickly adapting and finding new ways to connect with the community. I think this is, we're all adapting right now, right? So my goal today is not to talk about COVID in and of itself. I think if you're like me, we're all feeling a little oversaturated learning about COVID. My goal today is to really talk about how to manage your typical and ongoing health and medical needs in this COVID world. You know, how do we continue to stay on top of our health and manage our chronic illnesses in a reality where we're expected to stay at home and we're all trying to limit our community exposure. I think when this, kind of first hit us, it felt okay with the initial idea that we were going to push pause for a couple weeks and delay everything. But now that we're several weeks into this, I, as a care manager working with older adults, worry that people are ignoring and delaying their health care and feel fairly concerned about the consequences of that. Just for some context, I don't know if some of you saw, there was an article published by the New York Times, oh gosh, probably 3 weeks ago or so, and it talked about this phenomenon where people presenting to emergency rooms with strokes and heart attacks, those numbers are down by 30 to 40%. And that's very telling because I don't think everyone just miraculously stopped having heart attacks and strokes. So the worry there is that people are downplaying symptoms, people are ignoring symptoms, people are opting not to address their health care because they're worried about going to hospitals, because they're worried about risking exposure in the community. So the overriding message here today is that there are ways to get your healthcare needs addressed. There's safe ways. I think, weeks into it, I think what we're seeing at some of the hospitals, the clinics, doctors' offices, people have their protocols a little bit more put together now, where it's starting to feel a little bit more reassuring that if we need to, we can get out to see our doctors and our medical providers while still being safe. So I wanted to talk about so basically the overriding message is don't delay your healthcare needs. There's ways to get those needs met, and that's what I want to talk about today. You probably have been hearing a lot about telehealth. There's also virtual visits or virtual check-ins. You may have heard that word. And then there's also something called e-visits. They're all kind of similar. The differences in terminology really doesn't matter to all of us. It's really Medicare terminology and how doctors and medical providers bill for this sort of new way of meeting with their patients. But telehealth is a way that you can connect with an existing doctor or a new doctor you do have to have both telephone and video capability to actually do telehealth. And that's in a variety of medical providers are using telehealth right now, whether it be a primary care doctor, a specialist, mental health providers, even physical therapists, speech therapists. So there is a way to continue to get those services through telehealth if you have phone and video capability. If you don't have video capability, that's going to be a little harder for you to access. However, there still are other options. The virtual check-ins, that's really just a phone consultation with your doctor, but it does need to be with an existing provider. If you've been delaying following through on a referral to, for example, see a cardiologist for the first time, obviously that cardiologist is going to have difficulty evaluating and treating and making recommendations if they either have not seen you before or they don't have the ability to see you on video. So the phone consultation option is really for existing medical providers. And that can be, you know, just a quick chat with your doctor to talk about what's going on, whether it just be proactively checking in, or if you're having new symptoms or concerns, to be able to communicate that to your doctor via phone, so your doctor can advise on what to do. And through that conversation, they may be able to order new medication or talk about treatment or talk about best ways to manage that. Or they might talk you into coming into their clinic if they feel like that's necessary. But what I'm seeing is that a lot of people are feeling increasingly comfortable getting to that point if they've first had the ability to talk to their doctor to really weigh the pros and cons. Is this something that we feel comfortable managing on the phone, or does it really seem necessary for me to come to the clinic? The third option is what we call e-visits. Most of the medical centers have an online portal. That was even pre-COVID world, you know, with the transfer to online medical records. You know, there's a way that you can set up online access to your doctor's office, which is pretty handy because it allows you to message your doctor and usually get a quick response. I often feel like that's a lot easier to do than, you know, calling, leaving a message with the receptionist, and maybe you do or don't get a call back. I just feel like that online portal is a real effective way to get a quick question answered or to request a medication refill and just take care of things a little bit more efficiently. It's also nice because usually through those online portals, you can access your medical records, lab results, prior visits. So it's a great kind of one-stop place to be able to collect all of your medical information. Some of you probably already have that set up. If you don't, usually it's talking to your doctor's offices or the medical centers where you get your care, going onto their website and seeing what the process is to get set up for that. The other thing I want to share in regards to using that online portal is that if you have a trusted family member, whether it be a spouse, an adult child, someone you've designated as a healthcare power of attorney for yourself, I might suggest that you can consider sharing your online access and password to that online portal with a trusted person. And the reason for that is that if there were an emergency and someone is trying to quickly communicate with your doctor or access medical history to be able to help you or to be able to advocate on your behalf, that's oftentimes a real easy way for them to do that. If you happen to be taking care of a spouse or a relative, it's a nice way for you to be able to quickly communicate with their doctors and medical providers and get things taken care of pretty easily. So I suggest doing that if you haven't already done so. Secondly, release of information can be pretty important too for that same reason. If you've got someone designated as power of attorney or a spouse, making sure that your doctor, figuring out at the doctor's office, what is their process for release of information. That way, if you had a medical emergency or a concern and you needed someone to step in on your behalf, you want to make sure that they can quickly exchange information with your medical providers to be able to help you. So I think right now, when we're all kind of thinking about emergency planning and contingency planning, and you know, some of us have a little bit more downtime right now, it's a good idea to take the time to actually get some of those things in place. If through any of those options, telehealth, phone consultations, or the online messaging, if you and your doctor or medical provider determine that it feels necessary for you to actually come to the office or come to the clinic, or if they're recommending that you go to urgent care or to the ER for a particular reason, please know that it is perfectly okay for you to ask what to expect. For example, if you're going to your doctor's office, don't be shy about asking what protocols do they have in place to protect you and to limit your exposure. Like I said earlier, I think we're seeing, for the most part, that people are a little bit more organized now. There's been a little bit better access to personal protective equipment, masks and gloves, and certainly the medical centers and clinics are prioritized. But if it makes you feel comfortable, ask those questions. You know, will staff be wearing masks? What are your protocols for disinfecting the exam rooms before I enter? Depending on where you're going and the layout or the setup of the building, I know some people have asked to be able to wait in their car, and when the doctor's ready to see them, they get a call or a text and then they come in, versus sitting there in the waiting room where you might be exposed to other people who are ill. So don't be shy to ask those questions. Another question you might ask, I know some of the emergency rooms are particularly organized now, where if anyone walking into that emergency room has any sort of respiratory symptoms or any symptoms that are suspicious of COVID, they go to a completely different area and they're isolated immediately, so they're not sitting there in the lobby or the waiting room with other people. So ask those questions, and ultimately that might just help you decide whether or not you feel comfortable actually going to see your doctor in person. The other thing that I felt would be helpful to talk about is some of the changes that have come about with Medicare, access to Medicare benefits and services as a result of COVID. I think a lot of the kind of bending of the rules with Medicare are things we would have loved to see happen years ago. But now that we're facing a crisis, Medicare quickly made some changes with the idea that they don't want to put up any unnecessary hurdles in terms of people getting what they need to take care of themselves. One example is that however you get your medications, I know some of you might be on Medicare and have a Part D prescription plan. All of the Medicare prescription plans, even if they didn't do it before, should be giving you the option to get your medication refills in 90-day supply. So if you're not already getting that and that's helpful to you, certainly ask the pharmacist about that. If you're not getting your questions answered, you might also talk to your doctor. And then as a last place resort, you might actually have to call the plan to request that. But the idea is that that's limiting the amount of trips that people need to make to the pharmacy. Another thing is that they're allowing pharmacists to authorize certain emergency medication refills where, you know, typically, I'm sure you've all gone to the pharmacy at one point, you go to refill a medication, and then you learn that the refills have actually expired, and then the pharmacist needs to check with the doctor, get a refill, and sometimes that's a day or two before that process can take place. So they're giving pharmacists authorization to refill those prescriptions just to help avoid, you know, maybe the doctor's offices are a little extra busy, and so it's going to be slower response time, and then you're unnecessarily having to make now another trip to the pharmacy, and also potentially having a couple gaps where you're not getting your needed medications. If any of you on a Medicare Advantage plan, one of the big things that the Medicare Advantage plans have done is cut out a lot of the red tape. So those of you on those plans know that if you're accessing any doctor, any medical provider, any hospital, any skilled nursing facility, you have to use in-network providers to get the maximum amount covered. And they are actually waiving that requirement right now if it's necessary for you to utilize a different provider to get your healthcare needs met. That's pretty huge. It's almost too good to be true. My worry is that people trying to access that might run into obstacles, because what I've noticed in the past is when Medicare does make changes, the rolling out of education to the different providers is often slow. So providers might not know of these changes. So that's where an advocate comes in, or you kind of speaking up to, you know, help access those things. Another big Medicare change, if any of you have had a hospitalization, or if any of your loved ones or relatives have had a hospitalization, you might know that if someone spends 3 nights in the hospital and it's determined by the doctor that they would benefit from inpatient rehabilitation for a period of time, you have to meet that 3-day requirement in the hospital to be able to access that care. Medicare has waived that requirement regardless of what it's for. It doesn't have to be related to COVID. And the reason behind that is that they're trying not to unnecessarily hold beds in the hospital, knowing that other people might need to access those beds. And they're also wanting to limit people's need to be in the hospital, especially kind of in the earlier days when people are just worried about being exposed in a hospital setting. So it's great that it's easier now to access skilled nursing care if the doctor determines that you need it. I think the kind of tricky thing and the catch-22 is that you have to make an informed decision as to whether or not it feels safe for you to go to skilled nursing or for your loved one to go to skilled nursing, especially knowing that some of the skilled nursing facilities, unfortunately, have been sort of the harder hit communities in terms of COVID outbreaks. So I think it's just, you know, sort of a balanced decision of what someone would achieve or accomplish in skilled nursing and their comfort level being in that kind of setting. But the good news is that if it's necessary, it's a lot easier now to be able to access that level of care under your Medicare benefit. And then the last thing I wanted to say in regards to Medicare changes, I don't know if any of you have had experience with home health services. Home health services is also a Medicare benefit. And that's where if your doctor determines that you need certain skilled services, whether it be from a nurse, from a physical therapist, from an occupational therapist, from a speech therapist. There are home health companies that provide short-term and time-limited services in your home. So it could be in your home, or if you live in a retirement community or adult family home, those services could come to you there as well. In the past, home health was only accessible for people who were considered homebound, where it would be a taxing effort for you to go out in the community and access those services. They've loosened up the eligibility a bit, and you don't have to be homebound per se. They've changed the language to where you have to be confined to home. And if you have an underlying medical condition that puts you at higher risk for serious illness, if you're exposed to COVID, then you are now potentially eligible for home health services, which I think could be potentially very helpful to people who are living at home, who aren't getting their health needs met and aren't real eager to want to go to a skilled nursing facility or go to a retirement community to get their needs met. So I think that's a pretty important benefit. Now, of course, you know, kind of similar to going to skilled nursing, you have to think about potential risks of a home health worker coming into your home providing care, and some inherent risk of exposure by having someone come into your home. I will say that I've been in communication with some of the people I know working in home health companies, and it sounds like they've really got some great protocols in place to be able to protect people. They have a dedicated team that works with people who are COVID positive, and that's to ensure that they don't have a nurse going into someone's home where they're positive for COVID, and then they're going to somebody else's home who's hasn't been exposed to that virus. They're also able to access all the appropriate PPE, gloves, masks, gowns, so that they can come in and provide that care, but still keep you safe. And then the last thing, before I open it up for questions and conversations, there's a couple different resources that we have accessed recently for our clients. For example, we had one client living at home. She was overdue for some necessary lab work, and she was highly concerned about going to a lab or going to her doctor's office. But her doctor determined it was really necessary to get that lab work done to be able to know how to manage her medications. We were actually able to find a mobile lab. It was called Elite Lab. I'm not sure what their service territory is. I have to believe there's other companies, but we just called them, and they were able to get her doctor to send them an order so they knew what labs to take. They went to her home to do the lab work. That felt safer to her. She did have to pay out of pocket for it. I think it was about $60 to pay for that lab work, but to her that was worth it because she felt like that was, you know, a safer way to get that necessary blood work done. There's another company, they've actually been around for a while, at least I think they've been in our area maybe a year or two. They're called Dispatch Health. I don't know if anyone's heard of them, but
can you repeat that, please? Can you repeat that?
Yeah, Dispatch Health.
Dispatch.
Dispatch Health. Yeah, and
spell the last.
And Catherine, if you want me to, I can send some of these resources to you afterwards if you'd like to distribute them to people. Dispatch Health, you can access them in a couple different ways. They have a phone app. If that's convenient for you, you can just call them. You can go online. But they are nurse practitioners and physician's assistants that can do a variety of evaluation and treatment. So sort of typical things that you might go to urgent care for. So urgent care versus emergency room. For example, if you are worried that you have a urinary tract infection or an ear infection, or you're having chest pain, but it doesn't seem critical, there's a variety of things where they will actually come to your home. They have equipment to do a variety of testing. They can do lab work. They even have mobile x-rays. And it's kind of like on demand. It's like if you think about, like Uber or Lyft, it's like car service on demand. They're sort of like medical care on demand. We've had a couple clients use them over the last year, even before the COVID situation, and we've gotten pretty good feedback. So I think it might be a resource to keep in mind if you're feeling like you have a changing condition or a symptom that needs to be addressed, but you're not quite ready to jump in the car and go to the doctor's office just yet. So I can send that information on. And they do bill Medicare. They'll get all that, or any insurance for that matter. They'll get all of that information from you up front, and they bill insurance. So I think that's all that I wanted to share. I'll just sort of open it up for questions.
Anybody have a question? Well, I was concerned with that last, the Dispatch Health that you mentioned. So that's approved with most insurance companies, and they'll just pay the normal amount that they would?
Correct. Yeah. And when you call or schedule an appointment with them online or through the phone app, they verify insurance. So they would be able to quickly tell you whether or not they have a contract with your insurance and if there would be any expected out-of-pocket costs.
Oh, good. Yeah, I was concerned about that. Okay.
Yeah, the clients that we know that have used that service, they've had all of the visits covered in full. So there hasn't been any issues, just in a few cases that we've seen.
Great, thank you.
Sure.
Do you have a phone number for Dispatch Health?
Yeah, let me, if you give me 1 second, let me pull it up for you. And then I can email the link to Catherine. Let's see.
I don't do links. That's why I need the phone number.
I don't either.
And I did check the map to make sure that they do serve the Issaquah area. Let me just make
And what about Bellevue?
Yeah, I think they're actually based in Bellevue, but would serve Issaquah as well. So let me get you the right number. So their number is 425-553-4740.
Thank you.
Absolutely. I think it can be particularly helpful, like if you don't drive or, you rely on somebody else for transportation, or if you happen to be taking care of someone who's, difficult to get in and out of the car. It can be a real helpful resource for just kind of quick and easy things, as opposed to, going to urgent care or going to a doctor's office. I'm curious if any of you have been to see your doctor lately and how that experience was.
I have been to see two doctors. My name is Reva, and I've been to see two doctors. My first is my regular practitioner, and she told me there were absolutely no cases there, and the place is very clean. I had an early appointment at 9 o'clock. There weren't many people there. And she wore the doctor wore a stiff mask, and they had masks, and they take your temperature before you go in. And I live at the Bellatini, so a car drove me there. And, you know, I was pretty comfortable when I got there and they did all the, I wiped everything down. I wore a mask and gloves. I wiped everything down when I came back. I also had to go yesterday to the urologist, and I went 7 o'clock in the morning. So it was the first time that they had opened, and I was the first patient in. So, and that was a good experience for me as well. These are things that came up that I had to take care of.
That's
I don't think it could have been done.
May I ask which clinic? I wonder which clinic did you go for the physician?
I have a doctor in Bellevue that is just for seniors.
Okay, thank you.
And it's called Senior Health Care.
Okay.
And I see a physician called Dr. Fernando. And she's excellent. And if you have a problem, she calls you, and the same day. One day I was, you know, she's calling me about 5 o'clock. I said, Dr. Fernando, you still in the office? She said, no, I'm sitting in front of my fireplace. And she's just on top of everything. She calls her patients and talks to them and keeps you in the office, you know, for at least 20, 25 minutes, talking to you and caring. So she's excellent. And then I went to Overlake, I don't know, emergency care. It's not an emergency. It's a facility on Northrop Way. And it was the first time that they had opened. And I was the first patient in at 7 o'clock in the morning. They weren't open until that day. And I took care of what I had to take care of and came home.
Thank you for the information.
You're welcome.
I have to go to my, this is Maddie, I have to go to my doctor the end of May. And they said they had been seeing patients all the time, so I'm sure part of Overlake and Issaquah. I'm hopeful that they're doing everything that the doctor's office is supposed to do, but I'm going to go because I have an appointment. But
I'm
I will
sure
call
they
and
are,
ask.
Maddie.
Yeah.
I'm sure they are. I mean, they wipe everything down. And they
sure they
wear
will.
gloves and masks. And,
Right.
you know, nobody comes near you without a mask and gloves. They give you new gloves when you leave. They give you disinfectant when you walk in the door.
What do you mean disinfectant?
You
What's
know,
disinfectant?
like a Purell kind of thing.
Oh, I see.
You take your gloves
That's
off, you
hand
put your
sanitizer.
Purell on, and when
Yeah,
you
that's
leave, they do the same thing.
Okay.
They give you new
Thanks.
gloves, a new mask, and Purell on your way out.
Okay.
Has
Sometimes
anybody,
you just have
go ahead,
to
Reva.
go to the doctor. I said sometimes you just have to go. You have to take care of
Yeah, that's right. I'm glad it worked out well. So Jill, did you have something?
Yes, so am I muted or unmuted because I see it keeps changing?
We can hear you.
Okay.
We can hear you.
I've been going to my retinologist every 6 weeks because I have to go in to have the macular injections. Often there are no other patients there. We wear a mask. I definitely don't need gloves. And we have the injection and leave and all is fine. They wear masks and gloves because they're doing a sterile procedure. And we've been fine. Everything's fine. I'm positive. I don't fear all these things. And that's my outlook.
Very good.
What I need is a hairdresser. If you've got one roving about, I'm ready to get her to come.
Is there
We
something
all do.
for
We're
telehealth?
all gray.
And long hair and out of.
Yes.
Okay, thank you.
I have a question. I am changing my position. I was not so happy. So I am seeing her in June. I had to wait 6 months, but I have no symptom. Just saying hi to her because if I don't go there, she can't accept me as a new patient. But it is in June, so I'm thinking whether I should cancel it or not. I don't want to have a risk. But if I cancel it, I have to wait for a long time.
Sorry, did you say this is with a new provider?
Yes, I never met her.
Uh-huh.
Yes.
You could ask, if you don't want to further delay that appointment, you could ask if telehealth is an option for that whatever.
Okay.
Yeah.
Yes. Thank you.
Yeah, because you have video capability, that could probably be an option for you.
Yes, thank you. Oh, I should wait until my annual checkup because it's due in December. I have no medical I have no medical issues at the moment. I just want to change the doctor. So
Yeah, it seems like you should be able to, because I know I've had some issues too, and you know, it's some kind of platform like we're using, or the phone. So I think that's like a lot of places are doing that.
okay.
Mm-hmm.
Thank you.
Kim, I would call the doctor's office and talk to them.
Yes, I would do that. Thank you.
So any other questions
No.
for Nicole? Well, have you guys used, so Nicole was mentioning portals. I know I use MyChart for my mom, so, and I found that very useful when my mom had a stroke and I was having to talk with multiple doctors. Have you guys use that?
My daughter has, my daughter, you know, I'm not great with the
Okay.
computer, but she has, you know, all my information. Like she'll get an email from the doctor saying that certain things, tests have to be taken, whatever. She gets that information.
Yeah, I found it, you know, even if I have a question, I'll send it to her primary care doctor, and, you know, a nurse might answer. You know, I don't really care how I get the answer, but I think they like triage the questions and to see, you know, can a nurse answer it? Can the medical assistant answer it? And I've been really happy with that system. And then you get an email that they've replied, and then you have to open up, you know, the MyChart.
Yeah, but my doctor's office is, they have somebody on the phone all the time. You just call and you talk to a person. You hold on, and if you have a question, and it's answered immediately. It's a great practice. Perfect.
Well, I think I think it's good to have lots of options, and if you're not comfortable with the computer, that, you know, that you can still call. So
correct.
Just lots of different options. Because I might have might be talking to my mom like 7, 8 o'clock at night, and I'm like, oh, and I can just do it right then. I don't have to wait till it's
right.
You know, open office hours. So
I understand.
So Roger, did you have a question?
Well, I've used portals for years. I started with the VA using a secure messaging system. And now they've progressed to the point they've got Video Connect, which operates just like Zoom, except it's even better and it's more confidential. So I just had an appointment with my primary care doctor at the VA using the Video Connect feature, and it was wonderful. I don't see myself ever having to make another trip down there unless I'm really sick. It's great.
Great.
My biggest pet peeve was having to drive down there, which was a long drive, a very stressful drive. So I really applaud the VA. They've been right out in front of of technology and doing the very best they can for veterans, and I really applaud them for that. But I've also used a portal from Evergreen Hospital. So that connects me with a primary care doctor out here in Sammamish. I used to see him for years before I joined the VA, and he responds almost immediately to questions directed to him.
Great.
But other hospitals like Overlake have that too, and as you know, and so it's just, we live in an age where access is so much easier than it used to be. So you don't have to wait to get an appointment. You don't have to stand in line. It's all really special.
Good.
Oh, great. Glad to hear that that's working well. Yeah.
I almost missed your program this morning. I saw it in the newsletter, but I didn't see a link for it. So I just called Tina a few minutes ago, and she sent me the link. So I hope you don't mind my jumping in here.
Oh, no, that's fine. Yeah, you missed Nicole's talk. She talked for about a half hour.
Yeah, I'm sorry.
So we just finished that up. So we're just, you know, asking questions about, so she was talking about practical tips for managing healthcare needs. So in this time, because, you know, it's, seniors aren't, and others aren't taking care of themselves as well because they're afraid, you know, to go in to see the doctor. But there's lots of different ways to see and communicate with healthcare professionals.
I'm wondering, I used to take people from to their medical appointments through Eastside Friends of Seniors. And one fellow in particular had a lot of needs there. He needed appointments almost weekly. And now I'm not quite sure what's happening for him or how he's getting his needs met. I'm really concerned about it.
Yeah, I think that's been a big concern. One of the things I opened up with was there was a New York Times article several weeks ago about people presenting to the ER with strokes and heart attacks and other serious concerns are down 30 to 40%. So the only way one could interpret that is to believe that people are ignoring some of their health issues. So, you know, trying to get the message out to people that there are safe ways to still access your doctor and your medical providers, and, you know, ignoring or downplaying health issues is not what we want people to do. But, you know, obviously that's tough because it's contrary to the message to stay home.
Well, I'd certainly like to continue helping him, but not at my own risk. You know, I don't think I want to, you know, take him for rides here and there unless I know for sure he doesn't have it. So not quite sure how to help him out at this point.
Well, I think Eastside Friends of Seniors, I don't think they're doing as many rides as they are. I think they're also, you know, like bringing food or helping to bring things to seniors because of the virus.
Yeah, I heard about that. Maybe that's the way I can help still. I'll have to check with them and see. Yeah.
There's a very powerful article in the Seattle Times today on the mental health services that are being overwhelmed by depression and anxiety. So that might actually be another good talk to offer, because there are ways to access, of course, a crisis line is really well publicized, but there are other ways that people are trying to respond to the situation, which is pretty desperate for some people. So without, because they don't want to infect other people, but they need someone to help with mental health issues.
Well, that's a very important point. I know myself, I felt down on several occasions just by myself. And so, yeah, I can really see a need for that. help people understand better how they can get their needs for mental health services met.
One of the things I do is I teach a mindfulness class every week. So, so that has about 12 folks, including Jill and Kim and Reva and Maddie. So
Yeah, it is very helpful.
so
We enjoy it, that's for sure.
Yes. Mhm.
yeah. So it's a great way to get together and just to share different ways of taking care of ourselves during this time. So.
Mm.
Right. It's wonderful.
Yes, it is wonderful.
Mm.
Catherine, I was curious with the new 4-phase plan that just got rolled out. Was there any more clarity or guidelines on how senior centers fit into that, or not yet?
Well, yeah, I think so. We're run by the Parks and Recreation of the city of Issaquah. So, so our leadership sees us in phase 3, which is, recreation. So at 50%. Yeah, so we started meetings yesterday to figure out what we would do for the opening of the senior center, so we're just starting those conversations. So we figure phase 3, I mean, the earliest it might be would be like the end of June or July. So we're kind of trying to, what's that? Yeah, so we're, what's that, Jill?
It's too far away.
Oh, it's too far away.
Oh,
I
my
know
goodness.
it is, isn't it? I know it's a
You want to
long
be helpful.
time.
I want to sneak.
know.
Want to be,
people.
yeah.
I'm lonely. I'm
I
lonely.
know. Yeah, well, we don't want to get the virus, so there's just so much we can do.
You want to
so-
keep people safe, right? You want to keep
Yeah, we
people
want to keep
Have
people
you been
safe. We don't
upstairs?
want.
Can you give me a cup of coffee here? Because I'm waiting for my laundry.
Okay, I got to put this person on mute. Okay.
Hope you get your coffee.
Yeah. Yeah. So it is. Yeah. I mean, and we'll probably start with fewer hours and just a few activities, and so we're making those plans now.
Well, it'd be nice to see everybody.
I know. Yeah, it's really hard.
You think
You
testing?
can always come in for lunch and see us and get a to-go lunch. I know.
I'm too lazy. This is Maddie.
No, you're too lazy.
Yeah.
Oh, you're funny.
I am
Yeah,
funny.
because you're in your car.
You bring it to the car?
Oh, we
Catherine, do you
could.
bring the
We
lunch?
could. No, usually we just have people come inside, pay their money, like you normally would, and then go up to the window. But we can bring it to the car if that's what you want.
Okay, I'll
we
let
can
you
figure
know.
this out.
You
Okay.
might not hear from me. Oh, and I won't be joining tomorrow. My husband has to use the phone tomorrow at the time we have mindfulness.
Oh, okay.
Do you think I can use my cell phone?
Oh, sure.
Sure.
Oh, yeah.
I use
maybe
mine.
I'll come in on my cell phone.
Yeah, you can use your cell phone.
Okay, good. I don't want to miss it
Yeah.
if I don't have. Thank you.
Uh-huh.
You think some sort of testing will be required before the center reopens?
Testing before the senior center opens. I don't think so. We may do what, a lot of people do is like have some kind of forehead temperature check. I don't know what the protocols will be. We're still, the governor wasn't very specific on on what those will be, but I'm sure they'll be more specific as we get closer. You know, because salons are supposed to open, so we can get our hair cut.
Yay!
That's supposed to happen in phase. I know in phase 2.
Oh my God, give me a break.
I don't have that
I know.
problem.
Oh yeah, Roger doesn't have that problem. But I am just using lots of hairspray to get my hair out of my face.
This is Reva. I've gone to the hairdresser since I'm 13 years old, every single week. So but I have a great haircut. So I wash it and just brush it and it's fine. But that's the one thing at the Bellatini that everybody wants. We have a hairdresser right here, but they won't let her come.
Mm-hmm.
You know, there's a beauty shop right in the building.
Yep.
But
yeah.
On the paper of the Seattle Times front page, it said maybe in June they'll let us go to the hairdresser. So.
The woman that does my hair, she said the best thing you can do right now for your hairstylist is just wait for them.
Oh, okay.
Don't try to cut
your own hands and screwing up your hair that they're going to have to fix later.
right, absolutely.
Yeah, I usually wear my hair kind of down like this, but it was just falling in my eyes, and I was getting ready to cut it, and then I had this idea, and I'm like, oh, okay, I think I can do this for another month or two. I don't know.
And the beauty shop, the lady said to me that they're not going to let all the hairdressers work at the same time. So they're going to have it sparse.
It'll be a while before we can get in.
Yeah.
I decided to have my gray hair. So next time when you see me, I have a lot of gray hair.
Great.
Oh, that'll be nice to see. I didn't know you were green.
I have
already.
a friend.
I have a little bit.
I have a friend here who dyes her hair red. So now she said she's pink because of the gray that's going. So she's pink.
Right.
Oh.
Yeah, I'll go a little humor here, but I belong to Facebook, a Facebook group of owners of golden retrievers. And one lady has one lady has a female golden who loves to play in the mud. She's forever diving into the wet lawn and the muddiest spot she can find. So she's always covered with mud. So what advice would you give her?
God.
I don't know.
For helping keep her doggy clean.
Well,
I'll
your
ask my son.
presentation was very helpful. I really appreciate it. It was very informative. Thank you.
Yes, thank you.
Yes.
Yeah, thank you
Very much.
Thank you.
And everybody be well.
Bye.
Everybody be safe and
Okay.
well. Bye-bye.
Bye.
Yeah,
Thank you.
so
Bye-bye.
next week we're having
Yes.
Megan King will be joining us. So
It's every Tuesday in May.
every
same
Tuesday
time,
in
11.
May. Yep. Okay. Well, we look forward to.
Thank you, Catherine. Thank you, Nicole.
So,
Thank
This
you
is Matt.
so
Thank
much.
you, Nicole.
Take good care, everybody.